we're going to follow the ergonomic Dr. ABC. So DRABC: danger, response, airways, breathing, circulation. So what happens when you come across a patient? You come across the patient and you have to be aware of any danger. So D, you have to be aware of any danger to the patient, but also to yourself. This includes water, any electrics, any chemical biohazard waste. By doing this, just make sure you have a quick scan around and also up, because if you're in a building site, for example, you might forget to look up and there could be dangers, of course, above your head. And then we're going on to a response. So try and get the attention of the person lying in front of you. If you know their name, call their name, shout their name. If this doesn't work, go in further and call by both ears very loudly, okay? This might be because they're deaf in one ear, so make sure you use both ears. Also, give them a little shake and a little pinch just here, as it will cause a reaction to see if they are fully unconscious. So for example, Antonio, can you hear me? Can you hear me? Antonio, Antonio. Okay, so for this purpose, there's going to be no reaction, and we're going to go on to A, airways. So to make sure the airways are clear, we get 2 fingers on this hand and use our whole hand on this hand. Just under the chin and tilt up. By tilting up, it clears the airway and they'll be able to breathe a lot easier. Okay? Moving on to breathing. Breathing now, we use 3 of our senses. We put our ear next to their mouth so we can possibly hear and feel if they are breathing or not. Also, we look across the chest, down and the stomach to see if we can see any raises or not. And for the breathing, okay, make sure it goes on for 10 seconds. Even if someone comes and interrupts you, make sure you concentrate fully on that. But if possible, hold out a hand so they know to stay and wait for you. Okay? So for example, go down, airways, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay? And then you start C, circulation, so compressions. Whilst doing this, you shout and make sure someone tries to come next to you so you can call for an ambulance. You can get a portable AED and also a face mask. If no one's about, then you go off and try and do that yourself, call an ambulance, but return to the patient as soon as possible and start CPR, okay? Whilst you're doing it, make sure you tell that person to come back so they can assist you with CPR and to ensure that you've done it yourself, okay? So what we do, first you start off with 30 compressions, okay? You get one hand here, right in the sternum, interlink the fingers and go down, okay? You do that 30 times and then you move on to the breathing, 2 breaths, okay? So I'm going to use a face mask here. It is possible to do it without a face mask, even though a lot of people don't like to do it for hygiene reasons. If you don't, then just continue with the compressions until the face mask comes. So it's very easy to follow. There's even a diagram. You just place over the patient, make sure the circular bit is over their mouth, and then you do your 2 compressions. What you do is you hold up, hold their nose and push in. By breathing in, their chest will hopefully raise and fall down. And then you start your compressions again. And this cycle continues. 30 compressions, so 2 breaths. 30 compressions, 2 breaths until help comes. Okay? Once the ambulance, or if there's a portable AED in the surrounding or close area, then it should be brought with the necessary equipment, so the pads here. What you need to do is begin by turning it on.
Connect electrodes.
And as you can clearly see on the screen, it is instructing you to connect the electrodes. Make sure they're connected properly into this device here, and then you can look at the pads themselves, okay? So this one, as you can see, is down by the left side of the patient, and this one is on the right chest. So begin by peeling off, and one attachment there. And then the second attachment just down here by the side. Once the electrodes are connected, it will either tell you to continue CPR or it will charge and you'll have to shock the patient. Obviously, if you charge and shock the patient, everyone has to be stood well back to prevent electrocution to anyone that is involved with the CPR
Connect electrodes.
instruction. Okay, so you make sure you de-danger, check your surrounding. Anything wrong? No? Okay, go in, look for a response. Hello, can you hear me? Can you hear me? Go down, shake them, shake them. Again, no response. Okay, so A, airway. Fingers back, head back, then look for the breathing. Down. 1, 2, keep this going for 10 seconds. I can't see the chest going up and down. I can't feel any breath or hear any breath. So the patient isn't breathing. Then you go into the compressions, okay? Middle, middle, down. 1, 2, for 30 times. Then you call for someone. Paradise, can you please come back with an ambulance? Jay, can you please come back with an AED? And Natalie, can you please come back with the breathing units? Thank you. And you keep this up until the mask is available. Or if you're comfortable, doing mouth to mouth directly into the person's mouth. Okay, so once the mask is over, you go back, you hold the nose, you tilt back, and you breathe directly into the mouthpiece, okay? We're looking for the chest to rise it. Once, twice, and then straight back onto this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, so now we're going to do if the AED comes, okay? So you make sure the patient's clear. If it's a hairy patient, then you might need to shave the chest. Make sure the machine's switched on before you touch anything.
Connect electrodes.
And follow the symbols on the electrodes. At this point, the machine will assess the electrical current going through the heart, and it will either tell you to continue with CPR or it will charge and make sure you stand back whilst it shocks. Okay? Then it will tell you to continue with the compressions unless the shock has been, unless the electrical current has been found. If not, continue with the compressions. Yep. So in the middle and 30 to the beat of Staying Alive. So 1 every 100 to 120 beats every minute. Okay, and after that you breathe, CPR, breathe, CPR, and you have to make sure you follow the machine. So every now and then, I think it's every minute or two, it will try and reread the current again. Once the ambulance comes, or if there's one available, you'll be able to have this non-breathing mask. Okay? This is good for multiple reasons. One, it has a perfect amount of breath that you need to give, so you don't have to judge it yourself. And also, it has a perfect seal.